Okay, so I'll be talking about the pilot that we conducted. It's between at Hospital of Espírito Santo in Évora. So it's a large hospital in Portugal, partnered in SPHINX. We are working with the hospital to deploy innovative service which is based for remote monitoring of patients. And we decided to bring the environment and also the specific tool in order to test the innovations brought by the SPHINX Toolkit. So this is a joint presentation between Ricardo and me, so as an edge. In terms of summary, so I'll be try to be brief in terms of the presentation of the results. So it will be very practical. I'll introduce you what this innovative digital service. We'll explain the replicated environment that we prepared as part of the SPHINX project, where we could have a sort of a playing environment safe that would not disrupt normal operations. We'll discuss about the use cases that we designed for the pilot at ESE, also mentioning the ones which are relevant to show today. The deployment of the SPHINX Toolkit, which has a high number of modules, and we selected the ones which would be used in ESE, results we got, and then the conclusions. What we brought, so in terms of one of the innovative services we are bringing is the capability to remotely monitor patients which are put at home. This is a way to keep people, I would say, happier, and also hospitals with a better capacity. So people prefer to recover at home when it's safe. And to make it safe, we deploy with the hospital a monitoring tool assisted by technology, which allows for doctors and the care team to follow up the patient's well-being evolution in a number of ways. We integrate with various healthcare devices, also with smart home equipment, and we are able to provide visibility of the vitals, also of the well-being of the person remotely through our dashboards. Now, the challenge that we are bringing is that we are providing solutions which are installed and operate outside the hospital environment. And this is an environment which goes out of the control of ICT team, because networks are internet accessible. Some of the network goes into the patient's home. Patients are, let's say, user in general, they're not IT specialists, and many things can be affected by viruses or malware and so on. And there is the need for us to at least protect. So within this kind of a new inputs that we are providing, that we are able to keep the overall network safe, especially that this kind of a new services will not bring additional vulnerabilities into the hospital environment. In terms of the patient monitoring, what we started by defining a simple process. So just to know where the flow will occur, we are just outlining the relevant part for the execution of the pilot, in which we'll be monitoring the patients at home. So start of monitoring, again, as mentioned, there is the environment at the hospital and there is the environment at the home of the patient, in which the patient will be collecting and sending information. Some of it might be automatic or manual. Important is that then the information is put into the e-care system, which then the care team can follow up. In red, then let's say following based on this team, there is an assessment of the condition of the patient, which then can trigger, let's say, an alert. The condition seems to be worsening, so should we contact the patient? Should we even readmit the patient at hospital if things go a bit in a worrying stage? And then the process starts again. So continuous monitoring of the process over the several days. It is marked in red is the area which is especially important to protect within the overall system, in which is the way that the information is being gathered by the patients, and if an attacker is able to compromise this part of the process, can introduce fake data into the database, which then leads to wrong assessments, cause disruption, even might compromise the health and well-being of the patient. So this is the part that we do want to protect in overall, but especially this area here. So what we started, so in terms of the hospital, for having, as I said, the playing field would be to create a replicated environment from what would be the real environment of the hospital. This replicated environment, so we capture some of the systems and software which is running in normal operations. We then create a replica of the system, meaning that, and we put it in a sort of a sandbox in which we can do all sorts of attacks and experiments and without compromising the normal operations. So when we do this replication, of course, we are not replicating the data, because data can contain very sensitive information, it's personal. Either we introduce fake data or just generate some dynamics in order to have the system also to have with some content to explore. In terms of the replicated environment, it will be the part which is here on green. We have the SPHINX servers, the ones which will be running the SPHINX software and toolkit in one area. We have replicated servers, which are just depicted here on the right side. If you can see my mouse, so it will be here. And then a number of workstations which replicate normal workstations in ESA. In addition to computers, we are bringing also the bring your own devices like smartphones and also the connected devices to make this a bit more interesting, to know how they would be monitored and detected within the SPHINX tools. It is important to note that when we are replicating the workstations, and I don't know whether you'll be surprised, but in many cases we still have outdated operating systems which are being used by a number of reasons. They can be because it's the way that the legacy medical devices are connected, and they would be running on, for example, Windows XP machines, which are a clear point of vulnerability. So having this machine inside the network, it's really asking for trouble, because they have no protection or no real protection, and it can be easily infected with malware, which then can spread to other machines as well. But it's something which is still being used, because sometimes working with old blood analyzers, that's the machine that works. Other kinds of examples, it's Windows 7, which is also outdated, but that's still, in the process of migration to new systems like the Windows 10, which is currently, in terms of the most secure, in terms of the normally used workstations. Windows 7 is also plenty used. And while we don't still are migrating to Windows 10, we have an outdated machine, which is also an area of trouble. So it's important for us then is within this environment that we are replicating. We know we are introducing some vulnerabilities as well, because we want to know and to be alerted within the SPHINX toolkit when there is some trouble that can be corrected. What I outline in terms of the specificity for this use case is the deployment of the Edge eCare replicated environment. So you remember what I introduced initially, that we have the remote monitoring patient system, which is working. Now what we did is make a replica of this system, and then we both replicate the server, which we can just, attack as much as we want and like. And we also are replicating the users with smartphones and devices. And actually for SPHINX, we will be bringing these simulators, which will be generating data as if they would be normal users. As a disclaimer, so when perhaps more for a technical, more interested, the ESA did not allow network promiscuous mode. It's kind of a special mode in which we can just connect to a network and capture packets. Due to security reasons, this was not allowed, and as such, some of the tools of SPHINX could not be used. It's just an impact of the constraints that we had, but this was important for us to ensure the real security of the network. This could not be allowed in this environment. The pilot use cases that we designed for ESA, it's especially were four. Use case one, which you've already seen presentations previously, is the case in which we have obsolete operating systems in hospital. This is important for us, although it's a bit of I call it a standard case. It's important to know and to test it, because it's something always present in anywhere network. And we want to know how also to cope with this and how to whether the system is effective in detecting in the environment at ESA. Use case 5 deals with tampering with medical devices. This is where we would be exploiting vulnerabilities in legacy systems which run sometimes with Windows XP, if you can believe it, but that's the reality. And so they'll become very exposed to any kind, many sorts of vulnerabilities. Use case 13, that's where I'm going to spend a bit more time. That's the use case of interest in which we'll be exploiting remote patient care. So it's DCare essentially. And use case 17, I also talk a bit about it, because we'll be exploring where we introduced innovative services, but sometimes the manufacturer is really not implementing the necessary cybersecurity measurements and introduces also a number of vulnerabilities. So for this presentation, use case 13 and use case 17, that's where we'll be presenting some of the results with SPHINX. Okay, so starting point, the SPHINX toolkit at ESE. There was a more complete picture, which you've seen in the previous presentation. This is for us the instantiation of SPHINX in terms of for what we need at ESE. And remember, the fact that we could not use network promiscuous mode puts already as excluded, for example, the data traffic monitoring, which is a very important tool, but which we cannot use here. So we had a bit of a simplified system in terms of the automated cybersecurity tools. We keep the decision support and the dashboards to show all the information to the SPHINX user. Here would be the IT staff, which is monitoring the status of their cybersecurity. And on the right side, it's important as well to keep the components which deals with verification and certification to detect vulnerabilities and also to proceed with cybersecurity certification. We put here as well, as we are doing verification, also simulators which are conducting attacks in order to also be able to assert whether the components are really secure. On the top side, so this is the part which would be, I would say, unique within the whole project, is that we are bringing this new kind of tools, remotely monitoring tools, a new service for the healthcare, which is operating outside the hospital environment. I mean, while the IT staff can control the healthcare IT network, they cannot control what goes outside in a home of a person, or even the internet, which is the medium in which the information is flowing. Okay, so how this works? We created in the replicated environment a replicated eCare for ESE. It pretty much works in the same way as the normal system that we have. Through the dashboard, so the doctors and the care team can follow up their patients. We use colors as augmentation to notify, just to outline, is there some point of worry, which then the care team should look into and then make the analysis, human analysis in more detail. And the system, so it's the patients connect through the internet, which is quite, let's say, an open way to have broad access into the system. Also, as I said, that can bring also some challenges. And then multiple patients then can connect and send information into the eCare. This is being simulated. So as I've mentioned, for this project, we developed and deployed a number of simulators for the eCare clients. So this would be Persona, we call it Persona simulator. And we, I think, deployed 15 of them, at least more than 10. And I mean, this is something we can just scale to whatever number we want. In addition to the simulators, we developed also some, I call it hacked eCare simulators, but it's the malicious part in which now the SIM is actually either trying to, I can have in more detail. So either to conduct brute force attacks to try to get the password to guess the password of the user, and some other, the data integrity attack is where the attacker already has the credentials of the user, which was able to get either by brute force or by any other social engineering methods, and then tries to inject into the eCare with the fake data. And as you remember, for the assessment process, if we put fake data, it leads to the wrong assessment, and this can be quite worrying. So this was something that we developed, and we let it run into this replicated environment and see, okay, what can SPHINX do in terms of detecting whether the attacks are occurring or when, the intensity, and so on. So the integration of this in our slide, we have the patients on the left, eCare, the attacker, which is trying to brute force or trying to inject fake measurements into the database. We worked as part of this project in the integration between the eCare in one of the SPHINX tools. This was also quite unique because we were in the position to do it because we were one of the manufacturers of a healthcare service. Of course, it's our technology, and we were able to work with PDM, so with Stelios and the team from the CM tool in order to create the logs, which then the CM can capture through what they call a Metago agent, which then it's put into the SPHINX system and provides through the dashboards or through the specific tool the information for the IT staff. This is very important because we have the SPHINX, which is conducting a lot of analysis a lot of a wide range of the detection of vulnerabilities, of threats, of attacks, and we are incorporating an existing tool all in one dashboard. So it's one place for them to monitor the whole status of the network, and this is very important in terms of efficiency and response. This is through the interactive dashboards at the right. Very important as well is that the information, when there is an attack, we want to gather the evidence and want to gather, which then can support when going into court or to police investigations. So the forensic data collection engine. So this is also facilitated by the SPHINX, in which you can select the data. So it's there, the one which is relevant for the attacks, and then it's put as a kind of a set of evidence, which then can be used for follow-up for criminal prosecution. Okay, so some snapshots just for you to see the results. This is actual data after the tests we are conducting, putting attacks, and then, okay, what can SPHINX do for us? Ricardo, so from ESA would log into SPHINX, have access to the interactive dashboards, which has a list of all the relevant tools. By selecting the e-care alerts, so Ricardo is able to see then the number of attacks, and this is quite a total because the SIEMs were just running all the time, and of course Edge is protected, so Edge would say there is a potential attack, goes to log, captures, and you see it's quite, it's about more than 5,000 hits of a very intensive attacker which were detected. And we can also see either as a histogram cumulative value, we can also spread and see over time how when the attacks did occur. Very effective tool, and we can see it through so integrating an external tool, the e-care, into the SPHINX toolkit. In more detail, also the CM, which is the one which gives the information about the attack. So this is another view in which you can select the tool, then opens the specific dashboard, and you see, I mean, also in terms of hits, how many hits were detected, and also the logs, which are then captured. It's just an example, and it's a bit just for you to know that, so the information was there. It's also important, the logs, that they include information like who is the affected user. So we need to know if someone was able to capture the credentials. This is something you want to flag, and you want to immediately contact the user. Hey, your email is, or your other credentials have been stolen. It's better to change them. You know, the affected server, you know, the source IP of the attacker. This is something you want to know, and here GDPR will not be something you want to protect. There is an attacker, I want to know who the attacker is, and all the information which helps me to reach to identify the attacker. I really want to have access to it. So this is what CM is providing. In terms of forensics, so we also were able to integrate with the forensics tools. So we have e-care suspicious actions as was one of the threads that were created. We're able to import the data which was relative to the attack, and even to create a timeline, a sequence of events to know, I mean, what was happening over time. So very, very interesting to analyze. And all this then can be exported to a file, kind of an evidence set, which then can be used for, as I said, for criminal charges, further investigation, and so on. Okay, so this was for e-care. For use case, the other use case, which I'll just be bringing, it's a relatively simple use case, but we just want to mention that the possibility of introducing another service which could have cyber vulnerabilities, and how we could detect them within the SPHINX toolkit. So this case is about that we have the hospital again. The hospital wants to introduce also an innovative service in which they can monitor the physical activities through a fitness tracker. And there is a manufacturer which has the fitness, the activity band. It's very willing to provide it to the hospital. The issue is that the band is sending, so the manufacturer invested on the hardware and forgot about investing as well in cybersecurity. So the manufacturer was just concerned in putting data somewhere. It puts an FTP server, and the FTP server is really not the best way to send wearable data. So what happens is that this is being quite vulnerability, and in which this attack tools can, with relatively ease, have access and compromise the FTP server. And this is what the use case is about. So what we did is through the N2A tools, a number of attacks were performed. So the first one was, the attacker is trying to identify relevant services to explore, and it identifies services like the FTP. What we did for this use case, we deployed in SPHINX something called the Honeypot, and the Honeypot, it's the place in which we just put fake services which try to attract attackers. Hence the name Honeypot, to attract the bees, which here would be the hackers. So, and for us, it's important if the Honeypot starts to have access attempts, that this is flagged, because if someone is trying to use the Honeypot, most likely it's an attacker. You want to know it and you want to act immediately. So integration of the Honeypot, so it was also relatively smooth. The Honeypot was put in the network. We created one of them was the FTP server, the one of interest. And you can see that as the N2 tools were being executed, we were detecting the connections to the FTP server, and we could even have information about the username which was used. And since this is a tool, we want to verify what's happening, also storing the password which the attacker was used. So this is for the Honeypot. Another tool of interest is also the vulnerability assessment as a service, which we were able to run. Remember, so when I talk initially, the replicated environment includes a number of computers which we know are vulnerable. But sometimes you want to really have the tools to go through the network and identify things you know, but also things you don't know. So at the end, it's not a surprise, because we had a number of things which we know they are highly vulnerable, and then they are identified with different levels of vulnerability. So from low to medium to high. And I mean, 444 is quite a high number, which then we can have more information as going through the VAS to, okay, which machines are vulnerable. And the idea here would be that, okay, we identify if there is really vulnerable machines, just put them in a segregated network with a limited connectivity or even no connectivity at all. So it could be an option to do. But for the testing, as I said, we put all this in one network to have all these capabilities of detection. Okay, so and this is yet another also view of the VAS. Probably just go skip it, and then you can see it afterwards. Maybe. Okay, conclusions, just to show in overall what we had as an experience, so that the replicating environment was very useful so for us to demonstrate capabilities. Also very effective in for us to run in a way that it's quite safe for the whole network, not to affect other machines and so on. The ability for as an edge, so incorporated innovative solutions, also allowing to test cybersecurity beyond the hospital perimeter, which is, I think, where the innovations will come, is really to have an extended network outside the control. This brings the challenges we also want to test. Between the partners, Edge and PDM successfully integrated and demonstrated integration of an existing solution with SPHINX. And I mentioned this because, I mean, SPHINX is modular, so we can select the components we want to use, and it's quite integratable in some ways. So we can integrate with Edge solutions or with other solutions, and then SPHINX can be, I'll say, you see it below here, it's all in one. It's very convenient for the IT staff to be able to, in a minimum set of screens, to know the whole status of their network. So this integration is very important. So, and the final conclusion, so through the SPHINX, so we can really improve cybersecurity and cyber awareness of the IT. So again, all-in-one is very important. The all-in-one advanced tools, one place to check the whole status of the network, integration with existing tools. And I also mentioned, it's very important, sometimes not so much mentioned, but the capability to extract forensics data, it's really important. If something happens, you want to know details about what happened, with hints which then can even lead you to the origin and maybe who the attacker was. And this you can only do it by forensics information which you collect. So this is the presentation. I thank you for your attention.